Hello all, this is Dr. Dheeraj Masapu. I'm a consultant anesthesiologist, and today I'm going to compare emergency medicine versus anesthesia. So I'm going to cover this topic in the following headings. I'm going to tell you the difficulty of doing the course and the difficulty of passing, and also the soft skills required during as well as after finishing the course, and also regarding the fame that you get after passing. I would like to compare between the specialities of emergency and anesthesia and money also, the kind of money that you can earn in both the branches. Is it comparable? And then last would be job opportunities. So what kind of job opportunities are there after passing, and how is it going to be in future is what I would like to discuss. So before that, I would like to tell you a very important thing. So what happened is, after when I was in house urgency, emergency medicine was actually coming up those days. There was MD only in very few centers in India. I think in Tamil Nadu, I think some one or two centers had MD emergency medicine, and somehow from beginning actually I wanted to do something different. So I actually inquired about emergency medicine, and I came to know that it is still in the initial phases, and it is little risky to take up at that point of time. Then what I did is, I went and met one anesthetist in the hospital where I was actually doing my house urgency, and I asked him, so sir, emergency medicine I'm planning to take, is it really worth it? Then he told that I don't think it is really worth, because see, you just admit the patient, you just keep him in casualty for some time, and then you shift to particular some concerned specialty. So you really are not going to treat the patient. So you just work like casualty medical officer. So that is what he told me. And then after hearing that, I didn't feel like taking up the branch. I felt anesthesia is a more safer bet. But now retrospectively, I'm thinking, after doing all the research and after seeing how emergency has evolved, I've taken such a foolish decision those days. Maybe I shouldn't have inquired with anyone. Maybe I should have taken a risk and taken up the branch, and then just worked there for 2-3 months. If I wouldn't have really liked it, I should have left it, and then would have taken something. That would have been a better approach than inquiring with somebody who maybe didn't have knowledge about emergency medicine. Now maybe he would be having, but those days even he didn't know what emergency medicine is. So with that thing, we would like to start now. So what is emergency medicine? So what people think is, in emergency medicine, they deal about the vehicular accidents and heavy speed trauma, where the bleeding will be happening, intra-abdominal, and femur fractures, ENT bleeding from nose and mouth. So people would be thinking that is emergency medicine. Yes, it is a part of emergency medicine, only maybe 5 to 6% of emergency medicine. Emergency medicine is quite, it's a big spectrum. They involve so many specialities, and so many diseases are actually coming into that. That is what is the scope of the branch. So many people think the STEMI, the ST elevation MI, or stroke or trauma, this is what emergency medicine is. That is not emergency medicine. That maybe is 10 to 15% of the emergency medicine. I think you should hear to what Dina Shah madam is telling. She is a famous emergency medicine specialist in India, and you can hear to what she's taking. I have taken this clip from one of our YouTube videos, and you can just go through this.
As a ER, we don't only see the STEMI, stroke, trauma. We see a lot of other things as well, which are very fragile kind of group of people. Neonates come in, newborn coming in, pediatric patient coming in with seizure, where the family is stressed. We see the elderly coming in with undifferentiated unconsciousness, and we deal with every single age group in the community. Along with that, we deal with serious illnesses like oncology patients who are on treatment, very fragile, very delicate, and they've got only moments of time. Everyone is anxious, including.
So thank you, madam, for your info. So I would like to tell you, you can see on the screen, I would like to tell you what all emergency medicine actually covers, so that you get an idea of what you are going to actually deal. Acute abdominal pain, patients might come. That includes gastrointestinal. Sometimes cardiovascular diseases also will manifest as acute abdominal pain. Okay, then altered behavior and agitation. It can be a psychiatric problem, it can be a cardiovascular or endocrine problem. And then toxicology, all the poisoning cases would be coming to emergency, snake bites would be coming. And then would be children and altered level of consciousness in children. There can be several causes. Back pain patients also come. Nowadays, a lot of severe back pain, cauda equina patients, and pain radiating to one leg, and muscle spasm in the back patients are coming. And so even those patients you might have to deal. And bleeding, non-traumatic bleeding and traumatic bleeding, gastrointestinal bleeding, and many respiratory cases also might come. Cardiac arrest patients will come with cardiac pulseless electrical activity and asystole. You should be well versed with the ACLS. Chest pain patients will come with so many. It can be musculoskeletal or respiratory, or it can be a cardiac event. Crying baby also is there. Crying baby is a presentation to the emergency. So you have to deal whether it's an infection, whether it is an gastrointestinal thing. You have to identify what is the reason. Diarrhea patients would be coming. Dyspnea is a presentation. You'll just come with a rapid respiratory rate. You have to find out whether it's a respiratory cause or a cardiac cause or a fluid electrolyte imbalance, or it's a metabolic cause or acidosis. You have to find out. And then fever and sudden high temperature patients would come. Headache, severe headache patients also might come. Jaundice patients might come. Pain in the arms and legs patients might come. Seizures, shock, and skin manifestations which are severe, and syncope, and urinary problems like sudden urinary obstruction, or so many vertigo and dizziness patients might come. Vomiting patients might come. So these are the different ways people presenting to emergency medicine. Why I actually read out is so that you understand the spectrum of what emergency medicine covers. It's not actually one trauma or stroke or MI. There's so many things actually coming up in the emergency medicine. So you need to be well versed with everything. So your reading part will be very more, which I would be coming in the end of the video when I'm comparing anesthesia and emergency medicine. So how many seats are there? Let us see. So I've gone through the website, and MD in India, the 130 seats are there. And DNB, there are around 85 seats, to total 210 to 215 seats. So that's a good number. So if you're taking up MD, then so many colleges are there. So in Andhra Pradesh, SWIMS, it will be good. And then Narayana Medical College, Nellore must be good. And AIIMS New Delhi will obviously be the best. If you are getting AIIMS New Delhi, Apex Center is there. I've gone there. It is the best. You can do there. And you can see on the screen, JSS Mysore is good, JJM Davangere is good, MS Ramaiah is good, KIMS is good, St. John's is the best, and then Amrita Kochi is good, Mahatma Gandhi Mission Medical MGM Mumbai is good, DY Patil will be good, Ramachandra will be good in Chennai, NIMS, Nizam's Institute of Medical Science will be good. And in DNBs, I'll just show you. AIG in Hyderabad would be good. Apollo BGS Mysore would be good. Chennai Apollo will be good. Apollo Mumbai will be good. I think Apollos you can take in India. Indraprastha Apollo Delhi will be good. KEM should be good. Kasturba Medical College will be good. Kaveri will be good. Manipal Bangalore will be very good. Max Delhi will be good. PD Hinduja will be good. See, all these private hospitals, when you're doing, what I would suggest is, after that you go to AIIMS. and then work there for 2-3 years as a senior resident, then you'll get more hands-on, because hands-on problem might be there when you're doing it. You might get intubations and arterial lines and chest drains, but you need to do more in number, no? So that will be done in AIMS, in Apex center names. They will absorb any number of SRs. They will always have vacancy because it is a damn busy center, so they would take any number of SRs. So that would be a good approach for emergency medicine. Yashoda hospitals will be good. So these are the different hospitals in India where you can do. If you're doing in a private, then go to AIMS. Research, but like any center you're doing emergency medicine. After that, better to get exposed to a high volume center, because in emergency you have to deal the volume, and you have to get stuck in situations where you have to get stuck in different situations, like mob attacks. Also you have to see, and you should know how to deal the mob, and how to alert the police, and even every situation should be dealt. So only then you become a good emergency physician. So next, let us see what qualities emergency physicians require. So number one quality would be the action oriented person with adrenaline junkies, or whatever you call. So for them, emergency would be a very good branch, because most of the times there will be some amount of action. The polytrauma patients or MI, you have to do things very quick. A stroke patient comes, from door to needle time is what we see. From the moment the patient enters the emergency, how quickly you shift the patient to the thrombectomy zone. So for that, what is required? You should be dynamic and should be more active, and you should be, speed should be there. So these kind of people, if you're very slow and you want to just introverted, if you want to do your work, then I don't think emergency is a very good option for you. So that is number one quality. And second thing, your skills, hand skills should be good, because there are a lot of procedures involved, like IV lines. We have to take it in pressure. Why I'm telling skills is, see, when it is calm and composed, everyone can do, but when the things are out of control, when things are under pressure, and when somebody is watching you, most of the times people will be watching you when you're doing. So in that kind of situation, your skill should be good. So when you join, you'll have basic skills, but some people actually pick the skills very faster. I observe actually when two students are there, one goes very fast in the skill. So emergency is good for those kind of people. And leadership skills. So some amount of leadership skills you should be having. For example, if you're a team player, or you've played some sports in school, or you've taken up some leadership programs in your school or everything, then you'll know what leadership is. So for those kind of people, emergency will be a good option. And next, a team player and everything will come in that. Next would be patient counseling. So most of the times what happens is, if you're good in counseling, if you're good in convincing the patient relatives that things are under control or out of control or whatever the situation is, if you're able to deal a very aggressive patient relatives or patient or a mob, so that needs a personality. It will come with practice, but some basic personality also should be there. So those kind of people will enjoy emergency medicine. If you don't really like the interaction with people and everything, don't get into this branch, because here it is very much needed. So next, let us see this is personality of the person. What are the advantages of the branch? Number one advantage, it's a shift-based branch. So even though you work hard during that 8-hour shift, your shift is 8 hours or 6 hours or 12 hours based on that particular hospital. You finish your shift and you go and you switch off your phone, nobody is going to disturb you, because the next person would have taken over. And that is one. And the second thing would be the advantages. New hospitals are coming up actually. So I'm noticing a lot of new big corporates are coming. Every hospital needs an emergency department which covers round the clock. So many emergency physicians would be taken up in future. And then another thing what I was noticing is, most of the juniors with good experience and after a good experience in a good hospital, after joining in an institute, if they perform well for 7-8 years, okay, then they're becoming in charges. In charges are getting very good salaries. Okay, so in the advantages, I'll tell you. When I'm comparing both the branches, I'll tell you the salary differences. And then the kind of courses like ACLS, NALS and PALS and POCUS and USG and everything. So in anesthesia, actually, we have to be proactive and learn them. But in emergency, by default, everyone will know these things, because you are forced to learn it. Because without that, you cannot operate emergency. So you would be well versed with all the courses, and you will be very nicely certified person in emergency. and then all the branches. So basically what happens is, if you're an anesthetist, for example, I'm a neuroanesthetist, and so how many people would be knowing me? The neurosurgeons and head of anesthesia and some neuro ICU nurses would be knowing me. So there is no need for everyone in the hospital to know me, because my job is more critical, focused, and that's how it operates. But emergency physicians are not like that. Emergency physicians will have influence all over the hospital. So everyone will know, from security guard to CEO of the hospital. Everyone would know them, because they will be involved in multiple problems, and multiple troubleshooting situations would be happening, from shifting to bill payment to so many things. Actually, they'll be involved. So it will look like they are center of the hospital. So if that is your personality, if you want to be more famous in the hospital, within the hospital, then I think emergency medicine is a good option. And it's possible to take the leaves. Actually, even in anesthesia, it's possible to take leaves. Even emergency medicine also, it's because it's shift-based work. Bigger teams are there. It's not a monopoly kind of system. You can take leaves. So these are the advantages. Coming to disadvantages, the main disadvantage is there is no follow-up. So what happens is, follow-up. For me, a patient, after I give anesthesia, he'll be in neuro ICU. I'll follow him up. After that, I'll shift him to HDU, and then till discharge, I'll be knowing. So even though I'm not famous in the hospital, the whole course of the patient I'll be knowing. That excites me. So when you see the whole course of the patient, that's a different feeling, and they will remember you. In emergency, you save a life, but patient might not remember you, or patient relative also might not remember you. They'll actually remember the primary consultant under whom they are admitted. So this is one problem, but you'll be so busy that you'll not know that this is a problem. That is how it's working out now, because you just shift one patient to concerned specialty, and then another batch of patients come. So that is how it really operates. So you don't really have to think about this as a disadvantage, but that is how it will operate. So patients might not remember you in future, but you will always know whom you saved. So it's all for that. It's not for the patients to remember you. Anyway, you are not a revenue generating branch, so you don't have to worry about patients coming to you. You actually, this will come under service provision sector. And then the thing would be stress. Stress would be more, because that zone itself is a stressful zone. Because mainly when the patient comes with a crisis to hospital, the relatives have not adjusted to the situation, because they were living happily in the home, and suddenly something happens in the health of a person. They will go into a shock actually, and they would be in some kind of a denial mode. They wouldn't accept initially that something has gone wrong. So in that phase actually would be dealing, which is very tough. So by the time patient comes to my ICU, when I'm dealing, patient has been already been primed by emergency physician and the admitting consultant, and then I would enter the scene. So, but the initial phase is going to be tough. That is where the real pressure would be. Hope you're understanding. But if you get used to that, then over a period of time, you will develop your coping mechanisms on how to deal that, and you'll start enjoying it after that. Mob and violent attacks. You would have seen many people attacking doctors. That's become very common during the COVID times, and now I think in the last 6 months I'm not hearing much violent attacks against the doctors, or maybe I'm not following the news, I don't know. So if some attack is happening, that will happen on emergency physicians only. 50% of the times. 50% of the times it will happen on the admitting hospital specialists. So in that way, anesthesia people are safer, because they're always behind the screen. So they don't come into the forefront. So they are more safer in that way. Then there is a ceiling for salary even in emergency, just like anesthesia. Since it is a service provision sector, you are measured based on the quality of the service that you provide. And even though you generate revenue from emergency, see, many people get mistaken here. They will think they're generating revenue. You are generating revenue, but patient is coming for the hospital. So the management would consider that as a service provision sector only finally. So there will be a ceiling for that. You have to understand that. Okay, you can't show that we generated this much revenue. So that will not work out like that. It will work out as a service provision, and high quality service is what you have to target here. And then medical legal issues. A lot of medical legal issues will be there. Even for anesthesia, medical legal issues are there. Emergency also will have a lot of medical legal issues. So you need to have a good indemnity insurances. You have to follow protocols. Good video counseling would help you. And tough to do after certain age. Actually, what happens if you're fit? Age doesn't matter. Age is a number. And if you are not fit, and if you have some health issues, and if you're not very active, maybe and if you cross the age of 50, 55, it is very tough to do, because you have to constantly stand, you have to constantly counsel, you have to constantly run and be proactive. Even if you decrease the speed of operation, some mishaps will happen in the emergency. So doing it in the young age is fine, but continuing for 30-40 years would be tougher. If you in that way, anesthesia is better. Even for I've seen people practicing for 70 plus also. There are some people in Mumbai, I think, are practicing. So because it doesn't require so much of physical strength in anesthesia, but that is required in emergency. So the courses and seats, I told you how many are there. Nearly 215 seats are there. Between MD and DNB, I would like to tell you, MD, if you take, it's also based on the college. If you're taking names and it's a different story. So your teaching will be good. More hands-on you might get. And the protocols and everything may be better in a corporate hospital. But in corporate hospital, again, the problem is hands-on might be lesser, but they will give basic intubation and arterial line. So the number of cases might be lesser. But whatever case is there, you have to spend more time and learn from that. And then you can move on to, you can interchange actually. If you're working in a government, go to corporate and learn. If you're doing a basic degree in corporate, you go to government to learn. If you do like that, you'll see best of both the worlds. That is the easier thing and a smarter way of doing it. And if I want to go to abroad, there are so many opportunities out there. You can plan UK, Australia, every country needs emergency physicians. So you can finish your basic degree, work for 2-3 years, get good experience, and then go. Don't immediately jump off to some foreign country. So this is about emergency medicine, advantages, disadvantages, pros and cons. And then now I would like to compare between both the emergency and this one. So difficulty of doing the course, both anesthesia and emergency medicine are going to be tougher. But since it's a shift-based work, even if you get ripped off during the 8 hours in emergency and anesthesia as well, after that you would be relatively free. So difficulty of doing the course, if you compare this with a surgical branch or a medical branch, it would be slightly okay. It's not going to be, I'm not telling it's easy. At the same time, actually general medicine and those things in busy hospitals are very tough. They come early and they go very late. So because that is not a shift-based work, it's a patient-oriented work. So you have to treat the patient, and patient will be under you for 24 hours. So here you will have a shift-based work even during your post-graduation time. And reading part during the post-graduation time, both the branches are very tough. Because since I told you in the beginning of the video, the areas that you cover, like my spectrum is like starting from pediatric to geriatric, everything is there. So you need to read about brain, you need to read about heart and even fetal circulation. You have to read about so many things you need to read about. So reading part is there. So every day you should have a habit of reading, only then you can pass emergency medicine. And then the soft skills required. In anesthesia, soft skills are an option. If you want to excel, you learn soft skills. Okay. And in emergency medicine, it's mandatory. Without soft skills, you can't survive. Because since I explained how the mob attacks and everything happen, all those happen because of, if they don't have an agenda, then most of the times it is secondary to counseling issues. So if you counsel them properly, keep them in the loop from beginning, most of the times you can avoid. But if it's done with an agenda of extracting money from the hospital or something, that's a different story. And then fame. Both the branches won't get fame. You should have a clarity about that, because emergency physicians, you see the patients and patient relatives talk to you, but after that they go to the primary consultant. So they talk to you, but they forget you after that, because you are there only for 24 hours in their lifetime, or maybe less than that. so it won't be registered in the memory, so they might forget you also along with anesthesia people. So they will only remember the admitting consultant under whom they are there, and fame among the public you won't get, but fame within the hospital, enormous fame will be there. Everyone will know about emergency physicians, but even the best of the best anesthetists will not be known by anyone. Okay, so maybe the head of the anesthesia department and some zones like neuro and cardiac anesthesia heads would be known, but rest of the consultants and everyone, many people would not know, like how the emergency people would be known. And in emergency, even the junior person also would be known by everyone. So that because our operation style would be in that way. So coming to money, the kind of money, so entry salaries would be same. Around 1 lakh it will be after finishing the course. In North India, around 1.3, 1.5 you can get. But after that, what I observed is to become a consultant in anesthesia is tougher, because it's an age-old branch and so many established people are already there. So, and what is happening is you need at least 10 to 12 years of experience after MD to become a consultant, and most of the times it is becoming it's a vacancy based consultant position is coming up. For example, you have finished your tenure, but still it's not guaranteed that you'll become a consultant in a particular corporate. Every corporate has a different policy, but this is how it's going on. Okay, so but in emergency medicine I'm observing a different trend. After 5 to 7 years of a good experience after MD, some new center is coming, but you have to be compromising the city. For example, you want to stay in metro, it's a different story. And if you're ready to go to one step down, a tier 2 city, then you'd be made as a head and you're getting a very good salary. I have seen one of my friend actually was working with me before. I think 4 or 6 year experience she was having, and later on she was taken as a head of an emergency medicine in a tier 2 city, and around 4 to 6 lakhs, I think 4 to 5 lakhs she is getting. So it is a very good salary. To reach that salary in anesthesia, it would take more time, I felt. So why this difference is there is because of the demand supply. Everything boils down to demand supply. The supply is actually lesser, and everyone wants to stay in a city. So if you're little okay with going to one step down, then you would get a very good salary. So, but in anesthesia, it's not like that. Even if you go there, even those places are saturated. But still, there is always for a high quality person, don't worry. High quality guys always will get good salary in whichever branch you are there. That's a different thing. Job opportunities is the last thing. Job opportunities wise, both are in demand. Anesthesia is also very easy to get a job. Emergency medicine also easy to get a job because the basic salary is less. You will get a job. Then after that, how you grow depends upon your passion and speed and dynamicity and how actually you are conducting yourself. So many things will come, and that's it, guys. So that's about comparison between emergency medicine and anesthesia. Now, if you ask me, what should we take? So finally, you tell us which is better. We'll take that. So if you're dynamic and if you can handle pressure, take emergency medicine. No, sir, I want a cool life and I want to mind my business. Take up anesthesia. It is based on personality you have to choose. Work-life balance will be there in both because it's shift-based work. Work-life balance will be there, but during the work, you need a personality different personalities required for both the branches. Otherwise, you will not enjoy the branch. And abroad chances are similar between both the things, so there is no major difference in that. If you plan to go to UK, Australia with both anesthesia and emergency medicine, there are superb chances available at present. I don't know how it will be in future. Okay, so overall it's a good branch, and I strongly recommend taking emergency medicine. And good luck, guys, and that's it. As usual, Dr. Dheeraj Masapu logging off. Roger that.